Welcome to our broadcast. I'm your host, Britton Gray, Executive Director of Global and Domestic Immersion Programming at Providence. As a reminder, the details provided during this event are for information purposes only. For medical questions, please reach out to your primary care or healthcare professional. Now let's begin. Within Providence, we believe that health is a human right. And regardless of national boundaries, compassionate service to all has been a primary focus of our foundresses, the Sisters of St. Joseph and the Sisters of Providence, since they began their work. Building on this legacy, Providence's global team partners for impact through programming that honors the leadership, expertise, and goals of community and health leaders around the globe. We live our vision of health for a better world by working through local partnership to redress the systemic health inequities that are the legacy of colonialism. Today, we're excited to introduce our newest global partner, the World Telehealth Initiative, and share how Providence is partnering to expand health system strengthening and capacity sharing strategies through virtual service. Joining me during this live event are Carrie Schoenwald, Program Director of Global Programs at Providence, Sharon Allen, Executive Director of World Telehealth Initiative, and Dr. Nosa Akpede, Head of Department of Public Health at Arua Specialist Teaching Hospital. Let's open with each of you introducing yourself. Can you share briefly about your role and how you engage within the Nigeria Telementorship programming? Let's start with you, Sharon, and then hear from Dr. Nosa and Carrie.
Thank you, Britton. I'm Sharon Allen, the co-founder and executive director of World Telehealth Initiative. And I like to think that I have the best job in the world. WTI is in the fortunate position of enabling healthcare access for 50% of the world's population that may not otherwise have it. Furthermore, my role with WTI gives me the opportunity to engage with some of the most inspirational and dedicated healthcare professionals in the world, one of which you will be hearing from in a moment. So WTI's role in the Nigeria program is to provide the telehealth technology and then foster engagement between the Providence physicians that are providing their medical mentorship to those clinicians in Opoji. So today I'm just happy to be here and share with our listeners. Thank you.
Wonderful. Thank you, Sharon. Dr. Akpede, we would love to hear about you. Dr. Akpede might be frozen at this moment. Carrie, let's go to you and we'll come back.
Great. Not great, but Dr. Akpede is frozen. We know that she'll come back and we'll be so excited to hear from her. I am Carrie Schoenwald, as Britton said. I am the Program Director of Global Programs for Providence. And I've been leading this area of work with WTI over the last year or so. We have been engaging directly with World Telehealth Initiative for the very exciting opportunity to leverage one of the glistening and few silver linings of the COVID era, which is being galvanized toward providing digital opportunities for service for our caregivers to make impact and make connection around the world with other healthcare systems. And I have been deeply honored and very grateful to have a connection to such a phenomenal organization that really shares our values and vision. And I'm excited to talk more about it today. Thanks, Britton.
Thank you so much, Carrie. Well, we can't wait to include Dr. Akpede when she returns. For now, let's hear a little bit more. Let's dive into the initiative. Sharon, can you tell us more about World Telehealth Initiative and how your organization engages providers in global telehealth and telementorship specifically? What are the needs and concerns you work to address?
Happy to answer that. Not sure, do you want to jump back to Dr. Nosa now that she's with us for her intro?
Dr. Nosa, welcome back. We're so excited you're here. We would love to hear about you and your role, and then we'll proceed with additional questions.
Thank you. I am a public health physician in a teaching hospital in a rural area in Edo State, Nigeria. You know, Nigeria is one of the countries it's a West African country in Africa, sub-Saharan country. So I got into this by initially carrying out surveys because I actually am in Precious Gems. I'm the director of Precious Gems Nigeria. Precious Gems is based in United Kingdom, and Obo Akioyame is the co-founder of Precious Gems. So working with Precious Gems, we carried out surveys, several surveys in rural cities, rural towns in Edo State. There we found, remember, I'm also a public health physician. So I myself with my team, we did a lot of surveys, a lot of community outreaches, and we discovered that there were so many people in the rural areas that had no access to health care because these rural areas are geographically isolated. And we had many people with chronic diseases like hypertension and diabetes. So I brought it to the notice of Obo Akioyame. And then we also had, we were at that time collaborating with Urban Health 360. Dr. Unet Thomas is the president of Urban Health 360. So she linked us with Sharon Allen of World Telehealth Initiative. And this is how we came about this wonderful project. So with we had several deliberations, several meetings. We thank God we were able to receive the Teladoc machine, and we were able to set it up with we had a technician, a doctor, to medical doctor, who is a specialist in information tech and electronic devices. So we were able to set it up in Opoji Comprehensive Health Center. One of the surveys we carried out, we had about more than 3/4 of the populace had hypertension. So that is where we set it up because we felt, and the place is so geographically isolated, and we have lots of underprivileged and impoverished people, most of them elderly, because the youth and the middle age, they've all left for big cities. And so they needed care. So we set it up there. And so far, it has been very, very good. Thank God, we are on, it's still ongoing. We thank you for the doctors, Providence doctors. Sharon Allen did all this wonderful work. She brought in the Providence doctors, and they see our patients. Our patients are happy, as the people in the community. And then this new aspect, we've introduced medical students from Ambrose Ali University. Ambrose Ali University is a state-owned university in the nearby town. So right now, the medical students, the final year medical students, are also receiving tutorials from Providence doctors. It's been wonderful. I'm so thankful.
That's so phenomenal, Dr. Ekpede. Thank you so much for your leadership, which spans so many different aspects of this work as you've described. We can't wait to hear more about the experience of the providers and medical students on the ground. Sharon, let's go to you to hear more about World Telehealth Initiative and the needs and concerns you work to address that ties specifically to some of the concern areas that Dr. Ekpede already mentioned.
Sure. I'll start with the WTI mission, which is to provide sustainable medical expertise to the world's most vulnerable communities in order to build that local capacity while delivering core health services. And we do this through a network of volunteer healthcare professionals that are supported by the telehealth technology. The beauty of the Nigeria program has been the synergy among our participating organizations and how aligned we have found our missions to be. So Dr. Nosa initially requested mentorship with emergency medicine, internal medicine, pediatrics, and OBGYN. So Providence answered that call with a team of providers in those specialties. And in all of our programs, the site partners, the host clinic or hospital, is always that primary driver of any engagement. And they're designing the program based upon their specific health system and community needs, then WCHI affiliated volunteers step in to support the local practitioners to develop their knowledge and skills and confidence. And the underlying goal is really to treat more and more of their own community by those local practitioners. Thank you.
Thank you, Sharon. Wonderful to hear the intersectionality of all of these different pieces. And Dr. Akpede, I'd love to go back to you to layer in on what Sharon has now shared. We know that telementoring from Providence providers started in early 2022. And so we've had these clinicians virtually connecting with health professionals at the Community Health Center in Opoji. Can you share with us about what this telementorship model looks like on the ground? What are the needs the partnership is addressing and the learning impact for providers?
Okay, well, let me see, where I am, where I live, and where I work. I work in a rural area. Opoji Comprehensive Health Center is actually located in a rural, very rural area. It's a rural settlement and comprising of, we have of middle-aged and old people mostly. Like I mentioned before, the youth, the young ones, they've all left for urban areas. We have, in that center, we don't have specialists. Actually, the Public Health Department of IRA Specialist Teaching Hospital, located in a nearby town, manages the Opoji Comprehensive Health Center. So when I came on board as the head of department, I had to activate the center because we are having like 2-3 hours of service 3 times a week. I activated the center, myself and my team, my staff. We did about activated the center. We now had 24-hour service delivery. We did that because we were expecting the teledoc from World Telehealth Initiative. And then I drafted my staff, about 13 resident doctors, 10 community health extension workers, and 8 public health nurses on rotation to the center to run the center. So when we have received the teledoc robot, our residents, what we do is that whenever a patient comes in, the resident as in examines, collects the patient, examines the patient, and then presents the patient and co-manages the patient with the international experts. So in doing this, our residents are learned a lot. They are building capacity. They are sharing ideas, and there is knowledge transfer. They also, in this process, they're also having, how do I put it? They're having latest information on health issues at their fingertips. They are relating to their peers overseas, and this is building their confidence. And so not only that, on the part of the patients, we can see the joy in patients' faces when they are interacting with the international experts abroad. The patients are now learning, educated, they are being educated in the process, and they are also participating even when they are being managed. They are participating and they are being engaged in the process. So our patients are even happier now than they were when they were seeing our residents. Our patients are so receptive and they are happy. And they are learning about health issues at the same time. So this whole process has helped build our doctors, as in the doctors in my department. Those are the ones that are running the program right now. They're helping to build their professional capacity. It's helping to build confidence. And it's helping them relate to the wider world. At least they are no longer restricted here. Even though they are not traveling overseas, they are relating with their peers in the wider world. And I think it's making a major impact in their training. Well, for the Opoji as a town, Opoji is the teledoc relevance cannot be understated. Now the patients can come in without paying exorbitant fees. They see experts. Previously, it was just residents, doctors in training that they see. And these doctors in training manage them. And then when they have chronic cases or cases that cannot be managed by doctors in training, that's by resident doctors, they are referred to tertiary hospitals that are far away. And most of these patients cannot even travel. Most of them do not have the finances to go to teaching hospitals or big hospitals for proper management. But now they are now seeing experts just within, just let me say, a screen away, experts, specialists in the subspecialties in medicine, managing them. And they are able to also relate with these experts. So it's a change, it's a big change, a positive change. And we can see the patients confidence also building. The patients are now able to relate more of their problems where they were unable to express themselves before. They are expressing themselves better. That's why you could see that they express joy whenever they are in front of the teledoc, as in they can engage, they can relate, they can talk. They are not limited at all. They feel there's that joy in them. Yes, because they are now relating to experts. Experts are managing their cases instead of just residents in training. So our patients are benefiting. And then the cost, like I mentioned before, the cost is reduced. All they have to do is to get their drugs. After the due consultations and management, the investigations are given, their investigations are set out, and they do their investigations elsewhere, because we don't do typical investigations in Upoji Comprehensive Health Center. We don't have the machinery to do that. So they go elsewhere to do their investigations and buy drugs. The drugs are not available in the Upoji Comprehensive Health Center, are available in town, in big pharmacies in town, but at least they are managed there, and they are confident that they will definitely improve, that their health will improve. So is the how would I put it? It has a major impact in the lives of our people in Upoji Comprehensive Health Center. Then for the students, this is the first time our students are experiencing this. They've heard of telemedicine, they've heard of they heard of telemedicine, they've heard of virtual treatment, but they've never seen it or experienced it. But this is the first time they are experiencing such. They are able to relate to experienced doctors overseas. And just like I mentioned, their training is also improved. They are having information that they couldn't get anywhere, maybe except they search volumes of research books. They're having information in their fingertips, recent information on health issues. And they are being tutored by tutors that they would never have imagined they will come across. So it's wonderful. That's the only thing I can say. It's wonderful. Thank you.
Dr. Akpede, I love hearing the multi-layered impact and the joy that you mentioned within this work. We know that there's a bilateral learning that takes place through transformative relationship, and it's amazing to hear what's happening on the ground. Carrie, let's transition to you. Within our global programs, we see a connection between digital health, innovation, and compassionate service. How does telementorship relate to Providence's strategies for global health and partnership?
Yeah, thank you, Britton. And just to echo Britton, it is so moving and exciting to hear Dr. Nosa speak about what's happening on the ground and the heart and enthusiasm behind it, because while the strategy piece is a pushing forward of a way that we have always, as an organization and as a department, interacted with caregivers and with the greater world, it is also a sacred thing to connect caregivers to people around the world for service. It is a sacred moment of connection and a nexus of hope for all. So within our work, we have always followed in the footsteps of the sisters in terms of really reaching beyond borders to bring compassionate service to all across borders and around the world. And we've always done that through partnership, deep partnership with communities and with organizations that are embedded within those communities. And we have been given this opportunity during COVID to have to think differently about how we do that. So it has created, while it has created challenges in some of our other areas of work, it has also allowed to blossom something that we were looking toward for quite some time, which was a way to use digital innovation, as you said, with the nexus with compassion. And we have done that by partnering with World Telehealth Initiative that has such a far reach. And it was just incredibly opportune that as we were really seeking this sort of new COVID way to bring opportunities to our caregivers and bring our caregivers to the world for these interactions and this impact, that there was this Nigeria initiative being born, and Sharon invited us in, for which we will be forever grateful. Within our mission, in addition to serving all, particularly communities that are historically marginalized and oppressed, of course, we are always looking toward our values, our pillars of compassion, dignity, justice, excellence, and integrity. And those are absolutely all words that we can easily apply to World Telehealth Initiative. So that is that piece. But within our work, we have always been striving for the grassroots piece that is honoring of the communities that we are serving, that is promoting programming that is absolutely driven by those communities. And now in the 2020s, in the wake of all that the 2020s have brought, we are more focused than ever on, as an organization, I think, and certainly within global health, to really decolonize global health. And in short, that means to ensure that as much as is possible within the work that we do, that we are supporting work that is being driven by communities and benefiting communities. And so we work toward humility always in what we do, and a model of accompaniment. And our caregivers that are serving in Nigeria digitally, and our caregivers that serve always, bring that humility and understand that the opportunity for them is not to teach and change things. The opportunity is for them to be changed and for them to learn. And it's that bidirectionality and that communion that makes this work so powerful. And I can echo what Dr. Nosa has said about the heart and impact that has been happening on the ground, to say that the same has been happening for our caregivers. And I was tremendously moved when we recruited for this initiative. We were worried about imposing on physicians who were already experiencing enormous exhaustion and overwhelm from 2 years in this pandemic. But instead of being met with silence or critique of being putting another ask on people's shoulders, instead we were met with gratitude and hope and enthusiasm to have the opportunity for service. And that I found not only deeply moving, but incredibly, incredibly hopeful. So this has been a very heartening initiative, and I know it will only become more so over time.
Thank you, Carrie. It's so exciting to hear how virtual strategies are enabling service and solidarity through partnership, even through these difficult times. And I know the feedback we've had from physician volunteers involved that even though this is a trying time for healthcare, it's this kind of work that you're leading that's serving to renew and inspire them, and also inspire that sense of global citizenship that connects us to our broader community and family. Carrie and Sharon, I'm wondering if each of you could briefly comment, how do you see virtual service of this kind changing into the future? How will this work help us to improve and advance global health equity? Sharon, I wonder if you want to begin.
Sure. So, of course, we know the need is great. And now, with this project in Nigeria and other similar ones, we know we do have a solution. We have thousands upon thousands of providers that, as Carrie mentioned, they're looking for opportunities like this. They have a passion to share their knowledge. And so now we are determined to simply do this at a much greater scale.
Thank you, Sharon. Carrie?
Yeah, I would just tag on to what Sharon said by saying I think that the beauty of the digital technology is the democratization of knowledge, because a tremendous thing at the heart of the decolonization movement is about people whose countries have historically been the recipients of foreign researchers and foreign scientists and clinicians coming and learning about diseases there and then publishing research. Instead, this is an opportunity for that knowledge to be shared and spread, where there are health systems with tremendous skill and tremendous dedication from the clinicians within them, but low on resources and low on continuing medical education. And there is nothing that makes a health system and health system strengthening more sustainable and done in a way that is more ethical than through education. And this clinical mentorship is absolutely a form of education. I know that within WTI, there are many different models of how they work within the different initiatives they have around the world. But I know that that is a through story, and it is also a through story for us in how we work with our partners and with our partner countries. And so we hope to be growing a legacy of that increased capacity. And as I said before, within that, the beauty is that while our volunteers may go in thinking, oh, I get to be a teacher, they always come out as a learner. And so it is absolutely bi-directional. There's such knowledge and wisdom expansion that happens with that bi-directionality. And so that I think that democratization can only continue to grow through WTI's work around the world and through our partnership with WTI and other global telehealth initiatives. And I think it's tremendously exciting.
Awesome. Thank you, Carrie. Dr. Akpede, let's do our closing question with you. You've talked a little bit about how quality of care for patients has been enhanced through this programming. How might growth of telementorship in Nigeria improve physician retention? Are there aspects of that that are being explored here?
For instance, in our center, the resident doctors with this experience, they've gotten to know that instead of, at least with seeing their international peers relating to them, they don't have to cross borders, yes, to improve on their experience, yes, to build capacity, yes. So they can easily relate with just a screen separating them, relate with physicians from across the seas, from all over the world, and as in with exchange of ideas, knowledge transfer, they can build their capacity. Yes, they can increase their knowledge. And then this volunteering, yes, this effort that you are making, this goodwill, what you are doing, is also touching us, yes. And then I've heard some of them made up their mind that if people that they do not know can sacrifice time to help us out, is making an impact on them. That they also want, maybe it's also good, it's helping them, they're changing their minds. They also want to make impact in their community. They feel like they can also stay back if people that don't know are willing to share ideas, are willing to teach us, are willing to sacrifice their time to help us. They can also make impact in their own way, in their community, yes, where they live, in their workplace. So instead of running abroad, they can stay here and help their people. It's opening our minds. That is it. So that is a very good, it's opening our minds. And then I'm also thinking of, with this program, we can also think of doing certifiable courses. You know, our doctors, they move overseas too because they want to, like I said, increase knowledge, build capacity. And you do this with certifiable courses. If we can also use this means to carry out certifiable courses, and instead of them crossing over seas, traveling, they can do it here, and then build what we call our CV. Build our CV. So instead of traveling out to get this, we can use this means to build our CV, carry out certifiable courses that can also enrich our professionalism. And then it would be wonderful too if we can other cities or other towns can also experience this, can have this virtual program, because it's wonderful. Instead of as in being referring patients to faraway places where they pay exorbitant fees just to access a professional, access a specialist, you have it at your doorstep. You have you understand that you are perfectly managed, comfortably, comfortably. You are engaged in the process, participate in the process. You have it at your doorstep. You don't have to go out. Especially for chronic cases, because like I mentioned before, we have patients with diabetes mellitus, and hypertension. So it's beneficial for rural areas where you have lots of chronic cases. So they don't have to go far, because if they are to go far, they would rather stay at home. They won't move anywhere. They just die. They don't have the means. They don't have. We are really poverty stricken in our land. Sorry to say, most people in rural areas are impoverished. Yes, they're underprivileged. They don't really have the means to even feed themselves adequately, talk less of feed themselves. So when they are referred to bigger centers, they just give up. So now we have something in our doors. We have this virtual program that they can easily near them. They can work there, sit on the screen, sit with a channel, talking with a specialist, and then relating their problems, and they're effectively managed. We want that across board. We want it in other underprivileged and underserved areas. Yes, we want other people to experience what they are experiencing. It's wonderful. Thank you.
Well, within what you've shared, it sounds like there is a call to advance and grow this work. And it's powerful to hear how local providers are being supported with opportunities for continuing medical education that they may not have access to otherwise, or would otherwise need to travel for, which is very expensive and also takes other types of time and resources. Thank you so much, Dr. Ekpede, Sharon, and Carrie for joining us today, and to everyone for listening and sending in your questions. This has been a phenomenal conversation, and we look forward to seeing this work grow into the future. For all that have joined us today, if you'd like to learn more about our initiatives, programs, and services, or ways to give, or if you're looking for medical care, please visit providence.org. And make sure to follow Providence Health System and World Telehealth Initiative on LinkedIn, Facebook, Instagram, and Twitter. Thank you all and have a wonderful day.